I wondered if you could tell us if you felt any confidence in anyone we could support against the creeping nationalisation of the NHS, creeping privatisation, I would say, of the NHS.
Anyone you could support? I think we could support. What's here again? I don't want this to be a class political meeting. What I do want to say is that when I was the Health Secretary, we did introduce the private sector into healthcare. Why did we do that? We had a waiting list so long that 1 in every 4 patients on the cardiac waiting list, serious heart complaints, died before they could be operated on. You waited at one time years for a simple cataract operation. This was unacceptable. And so, to bring down that waiting list, we used private hospitals and we used independent treatment centres. Because the important point is, it was the same tariff. It was a single tariff. And the important thing is not to let that tariff go. So wherever you had the operation, the NHS was charged exactly the same amount. So you couldn't compete on price. And there were some places where we would put an independent treatment centre where clinicians would tell us we haven't got the capacity to bring that waiting list down. And where the very threat of an independent treatment centre actually galvanised a lot of action from, suddenly consultants could go to golf course on a Saturday or whatever, we suddenly got the waiting list down. There were other places, including near here, where the waiting list came down because we used independent treatment centres. Now, so that is an NHS service free at the point of need, getting rid of a terrible blight on the NHS, which is long waiting lists, which actually Rudolph Klein, the great historian of the NHS, said it had been a problem right from the start. And he said the captain shouted their orders from the bridge and the crew carried on regardless. And these waiting lists had to be tackled, and we tackled them. Now, there's a lot of things I don't like about what's happening now in the health and social care bill. But, a simple argument that says that the NHS has to consist of people that are totally in the public sector. We rule out GPs for a start because they've always been self-employed and, in a way, attracting themselves to the NHS. And would, I think, give you a worse health service, but the trick is to make sure, and I think the NHS constitution is the biggest safeguard. You don't need a political party to safeguard the NHS, as long as the constitution is strong and is perhaps written more into law. I mean, it's there as a kind of compendium to the legislation, but it's a very important protector of all the values of the NHS. I think the vast majority of the public will protect.
Should we come to a lady in the interview? Thank you.